Hi everybody, so today we're going to be talking about the ductus arteriosus. So now, the ductus arteriosus normally forms during embryonic development and it closes after the baby is born. So let's go ahead and take a look at this. And the first thing we're going to talk about is just some of the fetal circulation. So down here I'm going to have the placenta, and this placenta is where the baby or the developing baby or the fetus is going to get its oxygen from. So it's going to get it from the mother, and then it's going to come into the placenta and go to the baby. So coming from the placenta, you're going to have the umbilical vein. Okay, the umbilical vein is actually going to have oxygenated blood from the mother. It's about 85% saturated. And then it's going to come up here to the liver, and it's going to basically form a shunt that's going to go over to the inferior vena cava. So this is the inferior vena cava. Okay, and this shunt right here, we are going to call the ductus venosus. Okay, so that's going to basically, the blood's going to come and it's going to go to the inferior vena cava. Now, from the inferior vena cava, this is going to come up. I'm going to draw it as if it's come from outside the heart. It's actually would be kind of more behind it. But anyways, so here comes my blood, right? And let's use red because this is oxygenated. So the blood is going to enter into here. This is going to be the right atrium. Now, there's also going to be deoxygenated blood that's coming from above, and this is the superior vena cava. Okay, so that's going to be right here. So I'm going to have blood coming from here. This is going to be, it's kind of mixed. It's going to be mixed because this is deoxygenated and this has oxygen in it. But anyways, it's going to come into the right atrium. Then it's going to pass through this opening right here. The right atrium, or the right side of the heart, is going to have more pressure than the left side. And I'm going to explain why in just a minute. But this opening right here is known as the foraminal valley. And I actually have a video on this if you want to learn more about this, an atrial septic defect. But anyways, that's going to be the foraminal valley. This blood now is going to come into here, and this is going to be the left atrium. Okay, this is going to be the left atrium, right? And then from here, it's going to go down into the left ventricle. And then it's going to go out through the aorta, right? And it's going to go out to the body. So this is going to be the aorta right here. And then that blood's going to go out to the body, okay? Now, sometimes what's going to happen, or what basically happens, is some of this blood is going to come down here into the right ventricle, okay? But for the most part, after the baby is born, the blood from the right ventricle is going to go out to the lungs to get oxygen. But we already have oxygen, so we don't need this going to the lungs. So let's take a look at what's going to happen here. We're going to move right over here. So let's go to right here. Okay? And what we're looking at here is this is going to be a lung. This is going to be my right lung, and this is my left lung. So this is the right lung. And remember, this goes on the side of the person you're looking at. So this is my right, and this is my left. Right? And then over here is going to be the left lung. Right? And then this is my right atrium, this is my left atrium, this is my left ventricle, and this is my right ventricle. So here's what's going to happen now. Like we said, most of the time that blood is going to come to the left ventricle, left atrium, from the left atrium into the left ventricle, and then out through the aorta. So this is going to be our aorta here. This is actually the aortic arch up here. But we want to look at this blood here. So here's my right ventricle. RV stands for right ventricle. That blood now, when the heart beats, is going to go into this right here. And this is going to be my pulmonary artery. And remember, pulmonary means basically it's the lungs, right? So there's my pulmonary artery. And now that blood can go into the left pulmonary artery, or it can go into the right pulmonary artery. Here's the problem though. Is if you notice, we have this closed down right here. This gets smaller, right? So these are I'm going to call this the pulmonary arteriole, and now you have more than one arteriole, just so you know. Okay, but I have only drawn one. So you can see these are closed off. So I'm just going to call this the pulmonary arteriole. And these are closed off, right? They're decreased in size. Now, because they're decreased in size, it's hard for blood to get into the lungs. The reason they're decreased in size is because in the lungs, you have something called amniotic fluid. So the lungs are actually full of a fluid, and because it doesn't need oxygen, these are going to stay closed off, right? So we have amniotic. Now, what that means is because that can't go that way, that's going to have more pressure on this artery here, right? So this has to pump harder to get that blood up into the pulmonary artery, and because that has to pump harder, the right side of the heart is going to have more pressure. Because the right side of the heart has more pressure, now this blood from the right atrium is more likely to go into the left atrium through that foraminal valley and then down into the ventricle, right? So as of right now, there's more pressure here than in the aorta. So here's what's going to happen is during the embryonic development, the body forms something called the ductus arteriosus. Now I'm making this look like it's huge. This is just another small shunt that's there. And we call this like I said, we're going to call this the ductus arteriosus. Okay, that's going to be the ductus arteriosus. And so what's going to happen here is, like I said, that's just a little opening. So now, because there's so much pressure in here, this blood that comes up in here, it can't go to the lungs, right? Or actually, some of it does. Some of it does. In fact, depending on the source, about 10% of the blood is going to go to the lungs to help the lungs develop. The rest of it's going to come up in here, and it's going to go into the aorta and then out to the body. So remember, as of right now, because these are closed off, this pressure is going to force this up into the aorta, okay? Now, why does this stay open? Well, one, because there's cells here, right? And we have these cells that go along here. And we also have this on the ductus venosus. But what these are going to do, what the ductus arteriosus is going to do, is these cells are going to release something that we call E-series prostaglandins. And prostaglandins are basically vasodilators. Okay? So because they're vasodilators, that forces this to stay open. So now my blood's going to come up through here, and now it's going out to the body, right? So now, after the baby is born, before we go into that, now, here's the one other thing that happens, is this is also in the body also, right? And this is going to be down in the pelvic region. This would be my abdominal aorta. It's going to split into my iliac arteries, and then coming off, or the iliac arteries are going to split into two more arteries. They're going to split into what we call the internal iliac artery. So I have an internal iliac artery right here. I have another internal iliac artery right here. So I'm just going to put IA. That's internal iliac artery. Coming off the internal iliac arteries, I'm going to have two more arteries, and these are going to be my umbilical arteries. And what they're going to do is they are going to bring this blood that's deoxygenated back to the placenta. Okay, so it brings it back to the placenta. Now it can get oxygen, and then it's like we said over there, then it goes up and ends up going back to the heart. So now the baby's born, right? So what's going to happen now is we're going to cut the umbilical cord, or we're going to clamp the umbilical cord. Now this oxygen from the placenta has been cut off. Because the oxygen from the placenta has been cut off, the baby starts breathing on its own. So when the baby starts breathing now, what's going to happen is these arterioles and alveoli and the lungs in general are going to start to open up. Now, if you remember in physics, there's a saying that if I increase the volume, I decrease the pressure. So now there's less pressure going this way. This fluid is basically going to go away also. So because now the baby can start getting its own oxygen, right? Because the baby can start getting its own oxygen now, we don't need this anymore. So what's going to happen over the course of a few days up to a few months, this is actually going to close. It's going to form a ligament. Okay, so this is going to close, and it's going to form a ligament called the ligamentum arteriosum. Okay, and that's going to be the ligament that's in here. Let's make that M a little bit nicer there. So it's going to be called the ligamentum arteriosum. Now, sometimes what will happen is this won't close completely and we'll have an opening here. When this doesn't close completely, that's called patent ductus arteriosus. What's happening now is now we're going to have more pressure in the aorta, because remember, this has to pump blood all the way out to the body. We're going to have more pressure in the aorta now than in these pulmonary arteries. So now I can get oxygenated blood that's coming down through this ductus arteriosus that's then repeating and going back out to the lungs, okay? And for the most part, most of the time it's not gonna be a problem, or a lot of times it's not gonna be a problem, and they don't even do anything about it. Other times they have to do surgery and they'll go in and they'll close that up. Okay, so that's basically it for the ductus arteriosus. If you enjoyed the video, please hit the like and subscribe button, and we will catch you next time. I'm gonna leave this up here.